A very good morning and thank you once again for keeping it NTV Uganda. My name is Romeo Busiku and I'm here to talk about a very contentious subject. Yes, the correlation between COVID-19, the pandemic that is, and persons living with disabilities. I'm talking about the PWDs. How have they been impacted by the COVID-19 pandemic? Except the social and economic distress that they've gone through, there's also the issue of the psychological distress that is plaguing persons living with disabilities. When you say people should start social distancing, yes, people who are non-disabled will understand. But what about someone who cannot actually social distance because of various reasons? They need the support, the social support of the people in their immediate vicinity. So I'm here with members of the National Union for Disabled Persons in Uganda to have this conversation in detail. And I'm joined by Mr. Nkwangu Robert. He's the representative of the deaf on the NUDIPU board, that is the National Union for Disabled People in Uganda. And you also have, we also have Ayute. Yes, Ayute is the programs officer at NUDIPU, the National Union for Disabled Persons right here in Uganda. And a little bit later on, we shall be joined by the national, that is the director for the National Association for the Deaf Blind, which is Mr. Yona Waswe. He'll be joining us a little bit later on. But let me start with Robert Nkwangu and Ayute, who are already in studio with me. A very good morning and thank you for joining us on NTV.
Yes, good morning, thank you.
Yes, first of all, let's start by understanding what is NUDIPU, the National Union for Disabled Persons in Uganda. What is your role for the viewers? Let's start with you.
Yes, thank you, Romeo. NUDIPU is the National Union of Disabled Persons in Uganda. Formulated back in the 90s, to see that persons with disabilities are included in Uganda's programs. And in Kampala, we have different structures at the national level. And we have boards that elect these representatives of different categories of persons with disabilities. We have the physical persons with the disabilities, we have the blind, we have the deaf, we have also the parents of children with difficulty in learning, we have the little persons. All these are categories of persons with disabilities who have representation on the board. So we bring all of them together, all these categories as persons with disabilities to advocate for a unified voice to improve their livelihoods. So that's what we as NUDIPU do. And our vision is that we want to see that a fair and just society where persons with disabilities live a prosperous and dignified life. That's our vision, because we believe that using the human rights approach of persons with disabilities, they can ably live independent lives in societies equally to their peers without disabilities. Our work as NUDIPU is that we largely advocate for the rights of persons with disabilities, with having a unified voice to improve on their livelihoods. We believe that these rights are embedded within the laws, which they must enjoy like their peers without disabilities. Take an example of education, health, employment, financial assistance. I mean, all different sectors in Uganda are things that we advocate for to be enjoyed by persons with disabilities.
Deborah Ayute is the programs officer at the National Union for Disabled Persons in Uganda. Now you're wondering, a lady has been speaking, but then the voice that you've been hearing is of a gentleman. That is Bukenya Wycliffe. He's the sign language interpreter, and that's how we are going to be doing this as we move forward with this show. So let me also bring in Robert Nkwangu, who is the representative of the deaf on the NUDIPU board. Now, Robert, let's get into this conversation on people living with disabilities. Who are they, first of all? Who are the people living with disabilities, and what is their population in Uganda?
Yeah, thank you, Bosiku. Disability is a growing concept. It's an evolving concept. It starts with started with a few people, and then different categories came in. At the international level, we use the United Nations Convention on the Rights of Persons with Disabilities, and that explains the depth of who a person with a disability is. So it's a person who's having an impairment plus a barrier in society. When we talk about an impairment, I mean different categories of disabilities, like Deborah has explained. Take an example: I have a hearing impairment. I personally am deaf, have a hearing impairment. Then I cannot see. Sorry, I cannot hear. And people who cannot hear have different categories. Those that are profoundly deaf, they've never heard anything. Some can hear a little. Those are what we call the hard of hearing. Those are the people you see using hearing aids. But we are all under the categories of deaf. I can able to speak a little, but I can't hear at all. The other categories, for example, talk of the visual impairment. The visual impairment. Some have profoundly blind, and then others have a low vision. All those are also categories under the visual impairment. They use braille, they use large print, and they use the white cane in their livelihood. The other category are the physical impaired persons. Take an example: those that don't have limbs, they have an impairment. So they use wheelchairs, some use clutches, and then we have also a category with the cerebral palsy. All these are categories in the physical impairment. We also have mental impairment. Some call it intellectual impairment, whereby persons with intellectual impairment, they find it difficult in concentrating, and they find it hard for them to remember. But with the time, different categories came in. Take an example of epilepsy. Is part of the persons with the disabilities. We have the persons living with albinism, also part of the persons with the disabilities in Uganda. So it was approved that were part of us. So these are categories, and these define what disability is. It's a situation where one has a hard of hearing, difficult in hearing, difficult in seeing, difficult in movement, and difficult in concentrating and remembering. Or maybe also, we also talk of one who cannot do anything, but all are embedded in the concept of disability. So previously, that was 2014, according to the National Population Census, it is estimated that we have 12.4 persons with disabilities in Uganda. However, with the Uganda Functional Difficulty Survey says that 16% is the estimated number of persons with disabilities. However, Romeo, remember that this data is collected by disabilities, not that easy, because when you look at me, I look at Deborah, it is hard to tell that Deborah is deaf, and so am I. So it's difficult to tell the category of disability of someone unless when you engage with these people. But the census that was done, most of them that went to collect this data did not have these skills, so that's the number they came up to. But we believe that there are very many persons with disabilities, because when we talk over the intellectual impairment, it's difficult to tell. So with the data, it shows that 12.4% or 16%, but we believe that there are very many persons with disabilities in the country. Thank you so much.
Robert Nkwangu is the representative of the deaf on the NUDIPU board. When we say NUDIPU, you're talking about the National Union of Disabled Persons in Uganda. Now, did you know that loneliness, yes, and social distancing measures and so forth are actually having debilitating effects on our people who are living with disabilities. Yes, loneliness can lead to heart disease, if you didn't know. Someone who is lonely and suffering from intensified feelings of loneliness can actually develop heart diseases, even dementia. Your thought process, it all changes because you have no one to talk to and no support system. Like I did promise, would also be joined by Yona Waswa. He's the director of the National Association of the Deaf and Blind in Uganda, and he joins us right now in studio. Very good morning. Thank you for joining us, Mr. Yona.
Thank you very much. Good morning, and good morning, viewers. And I'm sorry I came late, but because border.
It's okay, sir.
Yes.
Let's talk about the impact of COVID-19. Let's get into the nitty-gritties. The impact of COVID-19 on people living with disabilities. Let's explore that. What has been the impact of COVID-19 on persons living with disabilities?
Thank you very much, Mr. Moderator and the
Romeo
viewers.
Buseko.
First of all, it is regrettable that COVID-19 came. No one expected it. Unfortunately, it has humiliated the whole world. But also worth noting is that whereas everyone has been grossly affected by the impact of COVID-19, persons living with disabilities have been the most hit. For example, I work for the Association of the Deaf Blind People in Uganda. Mr. Moderator and viewer, just imagine you don't see completely and you don't hear completely, and you exist. These people account for an estimation of 2% of the total population of Uganda. But I can inform you that they do not know what is going on. They even don't know that there's COVID. They even don't know of the various preventive measures.
But, Yona, I thought we were making strides towards that when it comes to disseminating information to the PWDs. You mean we are not making any strides?
Exactly. But as I've told you, people, for example, who are deaf-blind, they cannot read the messages.
Yes.
They cannot hear the messages. So what we do individual-centered education.
Yes.
We have to reach out to them. But interestingly, during COVID-19, everybody was blocked out. We're not essential workers, so that means they did not know of what was happening. I also wish to state that one of our members, Mr. Lawyer in Agago, was shot. I'm glad Daily Monitor reported that. Now, this gentleman was shot not because he was defiant, he was not complying with the directives.
Know what was happening.
But he didn't know. So these are the people who we are dealing with. I have just used the border when I was coming here. Most persons with disabilities, regardless of what disability, they use border for their day-to-day survival. Now, borders were closed. Most of our people with disabilities, they depend on medication for their regular survival and sustenance. Now, during the lockdown, most of them did not have access to their medication, so it's a bit escalated. The other problem during the lockdown was some people with disabilities, like the deaf-blind, they are severely disabled, and we have their family members quit their jobs to take care of their children, like Mr. Bidson. Bidson is one of our members, just in the chair here. He's a 37-year-old gentleman. He cannot see completely, he cannot hear, cannot walk, cannot he's permanently in a wheelchair. And the mother had to leave her job to take care of this gentleman. Now, during that time, the mother was not working. Imagine what happened. So, the impact of COVID-19 affected persons with disabilities and their families worse than other able-bodied families. Interestingly, Mr. Moderator and the viewers, there seem not to be a deliberate effort from either government or even humanitarian players to reach out to persons with disabilities. During the COVID, but even now people are talking about the recovery plan. You're a moderator, you're a journalist. Have you got anybody coming up with a comprehensive recovery plan on how they are going to reach out to persons with disabilities?
Not yet.
So that's the dilemma we are here today.
And let me also bring in the programs officer, that is Deborah Ayute. Let's understand, Mr. Yona has made very, very compelling arguments, but in your own opinion, as NUDIPU, do you believe the national response to COVID-19 has been inclusive of people living with disabilities? Is it disability inclusive?
Well, thank you, Romeo. Well, my brother Yona has submitted very important points, and I strongly agree with him, because COVID caught us unaware. Both the government wasn't planned for it, and so are we. So when government issued out a plan, persons with disabilities were never consulted. They developed programs, the SOPs, and everything, but were never consulted. So we saw very many gaps in these SOPs that the government came up. For example, when we talk of social distancing, I mean, how can someone with deaf blindness social distance? Yet they communicate in a model called tactile. Look at the blind. They need guides. The deaf, they need interpreters. Then person with a wheelchair, they need someone, a guide to help them go through. So having sanitizers, but then our environment in which we live in, take an example, one is moving on the ground. How are they going to sanitize? So at the national level, I mean the task force of COVID-19, we didn't have a representative of persons with disabilities initially. That was a gap we had identified. And then in the food distribution also, persons with disabilities, they missed because we didn't have this person. They are seated in their homes. They cannot come out to pick this food that government was giving out. Some of them are sick. They cannot access medication. So we engaged government at the national level to see that if we can have some representatives. And our members of parliament, one was appointed to sit on the committee of this task force, and that is at the national level. So they gave us an opportunity to see how we can have some subcommittees to see that our persons with disabilities can get response. Largely, on issues concerning disability, what we need is that the government, we needed some budget in the area of disability or COVID-19 response. When we talk of education, this studying online that has been ongoing online, I mean, you ask yourself, we have some disabled children. Can they understand? Can they learn? My brother Robert has just explained the categories of disabilities. It is hard for them to learn online. We needed some money to support these children with the disabilities to go in classes. When we talk of the health sector, we have the Ministry of Health that has been issuing out statements of COVID-19, and then 2 deaf persons fleeing from India, and they've been in lockdown for 14 days, but there's no information about them. How is the ministry communicating to these deaf persons? So you see, there are different gaps, Romeo, that have been identified. So we needed government to get in touch with us, such that we guide the government on these SOPs, and we believe that the Ministry of Gender, Labour and Social Development as well has formulated these guidelines for disability in response to COVID-19. So it requires government and different stakeholders to use these guidelines to see that persons with disabilities are best included in this response.
Wow, well said, Deborah Ayute, the programs officer at the National Union for Disabled Persons in Uganda. Let me also bring in Robert Nkwangu, the representative of the deaf on the board of NUDIPU. Now, Robert, let's talk about a really contentious subject. According to a report that was carried out globally, it indicates that 60% of persons living with disabilities are concerned about the situation that has been posed by COVID-19. When it comes to medical discrimination, many people with disabilities are saying they're being discriminated against when they go to medical centers. Is that the case when you come to Uganda? Have you experienced the same issue, being discriminated at medical centers?
Yes, thank you very much, Busiku. The area which my colleague talked about has an element of accessibility of information. Well, we appreciate that the government of Uganda to respond to, in response to COVID-19 has been largely good, I should say. However, I want to provide three key areas where this lockdown has been a problem to us. One, we talk of washing hands. Secondly, is don't touch the eyes and the nose and the mouth. And then the social distancing. When talk of washing hands is a very healthy issue, and it's true. But remember, different categories of persons with disabilities, some have physical disability, some have a vision impairment. So when you ask about the accessibility of these water points for them to wash hands, you could see that Busiku, there is a challenge when accessing this tap and then turning it on and then washing the hands. In our villages, take an example, Romeo, the water sources are deep down in the valleys, that the wells that we go to fetch water. Now, picture someone in a wheelchair or someone crawling on the ground going to fetch this water. So we are happy that using the sanitizers helped a lot. But then remember, my colleague Yona has just told you that persons with disabilities were among the poor persons. So at the lockdown, we didn't work at all. Our businesses collapsed. Our livelihood went down. And I have very many friends out there who are looking at us as leaders, asking us for food, asking us for, the baby's sick and all that. So that shows the level of poverty among these persons with disabilities. And it is hard for us to use these sanitizers, or accessing them and buying them. So the point is that how do we make these water points accessible for persons with disabilities? I saw some good innovations with where one could step on, it's like some kind of a pulley, and then water comes out and then wash the hands. It's something good we can also think about. It has been good. The second point is that not touching the eyes, the nose and everything. Persons with disabilities were at an increased risk of contracting COVID because we move by touching. We move by touching different services. Take an example, someone in a wheelchair and then wants to sit on this seat. So he will come, he will touch the ground to sit on his chair. Then someone who is blind, he needs a guide, will touch different surfaces. So that puts us at a risk of contracting this COVID-19. So, and then we depend on helpers. We depend on guides to lead us through. So all this puts us at a risk. So we need to sensitize how the caregivers and the family members on how they can support their members with persons with disabilities. The issue of social distancing, like we're seated here, and then the campaign of Ton Sembe from our our minister. So you can see that Honorable Minister spoke something it was a very good message, very nice message. But I am deaf. I can only look at her. I don't know. There wasn't any interpretation. For hard of hearing, they can read the captioning. Well, NTV, I want to thank you so much. for the captions that usually put on especially very important messages. These help us understand. So these messages is needed to be embedded in captioning, such that our members can read. And also, if we could have an avenue of having interpreters. So we are happy with NTV that that we have our interpreters called. We have Susan and Maureen here.
Yes.
They've done a very good and tremendous job to us, the deaf persons. So we are always tuned on NTV, waiting for the news. But then other messages, unfortunately, we are missing, Bosiku. Talk about the persons who depend on support, on helpers. So it is hard for them to have this social distancing. But largely, the problem is that persons with disabilities, some at times, we're at risk, with our health, because people with epilepsy, persons with cerebral palsy, mental health challenges, all these are at risk because post-COVID, they're going to lose jobs. And then parents also have been having some kind of violence at home, and because of not working. All these is impacting on us persons with disabilities. So largely we need accessibility to information. And then we appreciate with the Ministry of Health for publishing this information in print, and we believe it will be useful. Thank you.
Well put, Robert Nkwangu. Access to information, access to sanitary services for persons living with disabilities. But what about access to medical services? That's a conversation I would like to have with you, Mr. Jonas Waswa. Access to medical services. One too many times you've had people with disabilities complain, I cannot get to a medical center, I cannot get from point A to point B. And even when they get there, there's that discrimination of, no, we should first handle the people who are non-disabled and we shall handle you later. Why do you need sexual and reproductive health services? There's that kind of discrimination against persons living with disabilities. What do you make of all that?
Yeah, thank you very much, Bwana Moderator and the viewers. I think the beginning point is that there is a general concern about the health service delivery in this country. I think that's not in doubt. But again, when it comes to persons living with disabilities, the situation is quite worse. It is worse, it is threefold. First of all, the inaccessible health service systems in terms of the physical infrastructure of most of the health services, health units. Most of them have ramps. Don't have ramps. They have steps. And now, if I'm moving on my wheelchair, then it means I cannot go to some. I cannot see some specialists who sit on certain levels of the buildings. Now, the other is inaccessibility in terms of information, health information, both within the health facilities, but also the primary health care information services. Now, here we have much to do with the current health workers don't have the expertise to respond to the needs of persons with disabilities. I'll just give you an example. If I go to test for HIV, for example, I have a right to be told my results by a doctor or whatever health worker. But do they know sign language if I'm using sign language? And I'll have to use another gentleman or lady, either whom I have gone with or from the hospital. Is my confidentiality assured? In the event of breach, do I sue the doctor? Because for them, at least, they have that oath. I can't sue them. Do I sue the doctor or I sue the interpreter? Now, but also generally we have inadequate specialists because disability is diverse. That's the first thing I have to let viewers know, that disability is diverse. And each disability requires a specialized intervention. Now, if you asked me how many audiologists, how many ophthalmologists, how many orthopedists do we have in the country? Go on mentioning each specialist, neurologists, people who deal with people with mental and epilepsy and those related neuron-related cases.
Right.
How many do we have in the country? So, and then the other last, because I said the challenges are threefold. Now, the other last challenge that we have in health service and persons with disability is the attitude. But even now, there are ladies and gentlemen who feel that when you have a disability, then you cannot contract a certain disease.
Wow.
Attitudinal
challenges still persist.
Exactly. So the first question a medical worker will ask you will be, how did you get this? Our sisters are being asked, how did you climb the bed when you're conceiving? If you cannot climb this bed to the delivery bed. I've seen colleagues who have gone to test for HIV. Then you will hear this whole medical setup saying, hey, Mananga, also for them they have come. How did they? Hey? So that attitude.
That discrimination.
It is very, very bad. So
very wonderful argument by Jonas Waswa. He is the director of the National Association of the Deaf and Blind in Uganda. You also have Mr. Robert Nkwangu. He's the representative of only the deaf on the board of NUDIPU, and you also have the programs officer Eyute Deborah right here in studio with me. We are going to be expounding more on this conversation. We are talking about the correlation between COVID-19 and people with disabilities. Now, it is important not to conflate health status with disability. So many people that have disabilities are actually living a healthy life. We'll expand on that and a lot more shortly after this break. We'll be right back. A very good morning once again and welcome back to NTV Uganda. We are still expounding on the correlation between COVID-19 and people living with disabilities. Like I did mention earlier on during the show, worldwide, 60% of people living with disabilities are actually concerned and are very, very worried about what has been happening during the COVID-19 crisis. The medical discrimination, you go to a health center and you're not getting the help that you need in that regard. But also it is important not to conflate health status with disability. I'll repeat that. It is important not to conflate health status with disabilities. Not all people who are actually grappling with a disability are actually living poor, healthy lives. Some are actually living very, very great lives. I do also have Deborah Eyute, the programs officer at NUDIPU, the National Union for Disabled People in Uganda. And I also do have Mr. Robert Nkwangu, who is the representative of the deaf on the NUDIPU board. Last but not least, we do have Jonas Waswa, who is the head of the Association of the Blind Deaf in Uganda. Let's talk about who is at risk in this case. Like I mentioned, it is important not to conflate, yes, health status with disability. So who is at risk? Deborah Eyute, help us understand who is at risk when it comes to people living with disabilities.
Yes, thank you, Romeo. It's important for us all to understand that someone who is at risk. But these categories of persons with disabilities, some are very vulnerable compared to others. Take an example, Romeo, of the deaf-blind. These are largely more vulnerable and are at risk because they cannot hear and they cannot see. Imagine that. Which means they cannot access this information that is going on media. So they depend on support from their families. Persons with a cerebral palsy, right? They cannot move their bodies ably like you and I can. They cannot hold cups by themselves. They may not be able to go to the toilet by themselves. So they largely depend on their families, and yet we're depending on families, there's contact. So it makes them at risk. Persons using wheelchairs, you see, these wheels can move anywhere on different surfaces, on ground, in the toilets and everywhere. So they contract these germs and then they transmit these to the user. 2 weeks ago, I'll give you an example, Romeo. We are at NUDIPU and there's an organization called Motivation. There's a good opportunity for us to engage with the KCCA with support from World Vision Uganda. And we've sensitized the health centers around Kampala, about 30 health units in Kampala for the entire week. And then we've largely been focusing on the inclusion of persons with disabilities in response to COVID. Well, I'm happy to inform you, Romeo, that they were not aware of all this. They didn't know the needs of the persons with disabilities. Well, I want to appreciate that that information has helped us to improve on support of persons with disabilities. The other special thing that I want to put across is that the referrals, referring a person with disabilities who is suspected to have had COVID. I mean, these are signs and symptoms. I mean, calling someone from the Ministry of Health to come and to rescue this person is quite important. Information to be given to this health officer that so-and-so is deaf, or so-and-so is blind, or so-and-so is deaf-blind. So this helps the medical officer to get this knowledge prior to the person that they want to respond to. So it's so sad that most of these health workers don't get this information. And the other high risk is that the deaf. Well, we are lucky that we could be seeing information on TV, but that only depends on those who can see it right now that have these media platforms. But those deep in the villages where they cannot access these TVs and all that, they can't access this information. The radios, well, we largely don't depend at all on radios unless we have some family members. But these media houses and information and TVs and all that can only be accessed by people living in towns. But deep in the villages, also the deaf cannot access this information, which puts them also at risk, Romeo and the viewers. Thank you.
Thank you very much, Deborah Ayute. Let me also bring in Robert Nkwangu, who is the representative of the deaf on the NUDIPU board. Robert, let's talk about another contentious issue. You see, people with disabilities, it's also contended that they are actually grappling with fears alike, being classified as high risk. Do you believe that it's also having a detrimental effect on people with disabilities? Yes.
Well, just like Deborah said, people with mental disability, the deaf-blind, and people with the severe disabilities, they are very, very at risk. They have different challenges. And seriously, if you look at the categories right now, they all have been asking NUDIPU for response for different services. But then NUDIPU doesn't have all these resources. Well, government is there, but many feel that the DPOs, the umbrella organization, is closer to them than government. So they find it easier accessing services from their DPOs than the government. So with the leaders, Waswa, Deborah and I, they've been asking us for different things, for food, how do I need to go to hospital, could I use the NUDIPU vehicles and all that?
Yes.
So they've all been asking us a multitude of different questions. So it has created a big challenge because we feel that at times our hands are tied and we can't do any further. And then we feel that this creates a very big risk to them. I saw a friend of mine walking, but is walking over 10 kilometers from home to hospital. And then this person having a disability, at times they give up because that distance, they can't, take it. So at times they try vehicles, And then the transport is not accessible, Romeo. The taxis are not accessible. So this increases the risk.
And of course, let me hope Robert understood my question. You see, we are branding people with disabilities as high risk. Now, that branding itself, isn't it causing fear among people with disabilities? The branding itself as high risk.
Well, at times people with the disabilities are not interested in that, in that special care. At times, if you concentrate on this special care, then it causes a stigma to the person themselves. When talk of special services for people with disabilities alone, medical care alone for persons with disabilities, so there is that feeling of stigma that comes within us when you put everything special, special, special. Well, I agree with you. There is fear. I strongly agree with you. I strongly agree with you. But we need to separate this and remove it, because we need a society where if there is special food, people are going to say, "Oh, you're lucky, for you are given some special food. You have your own food. You have your own programs. You have your own everything." And then that ideally means that you're creating two groups of people, those with special needs and those without special needs. So that creates fear, Romeo. The point is that it is important for us to have an inclusive society whereby we are all responding to COVID equally and having an entire budget which is has budget lines for each and everything, including persons with disabilities, and then they can also benefit from all their programs.
Well put, Robert. I like that argument. He has put it very, very well. Let me also bring in Mr. Yonowaswa. We are wrapping up with key recommendations to government and other stakeholders. And in this case, we are talking about key development partners like NUDIPU and so forth, who are actually working so hard to alleviate the problems of the people with disabilities. So what are some of those key recommendations moving forward to ensure a COVID-19 inclusive response that is actually disability inclusive?
Thank you very much. Before I make those recommendations, permit me just use like say half a minute to
go ahead.
Somehow say why people with disabilities are being ranked as
high risk.
High risk.
Go ahead. Yes.
I think the first question should be where are they being ranked? Now, when you ask that question, why are they being ranked? Then the answer would be, what are they going through during this COVID-19?
Yes.
Now, I'll just break two or three things that are making them, I think, to be higher at risk. I told you some of the preventive measures is social distancing. Now, there are people with disabilities, for example, those who are deaf-blind. They communicate through tactile communication. Now, that means that you cannot separate the individual person with disability and a caregiver who is communicating to them. Now that gives them that makes them at risk. We said the COVID-19 information is leaving them out. So that somehow expands their vulnerability.
Yes.
And for us, we are saying that they're the invisible and forgotten victims of COVID-19. Not even the media is taking interest in finding out where these 2% of the total population are. And for me, that makes a particular section of persons with disabilities more at risk. And indeed, it should worry every concerned citizen. Now, I'll go to the recommendations. Broadly, I'll recommend 4 things. The first thing is that the government social protection program should extend to cover vulnerable persons with disabilities like the deaf-blind. Currently, in order for you to benefit from the social protection program of cash transfer, you must be an old person over 80 years and above. But there are families, I told you, a family of a gentleman in Kira here who cannot see, cannot hear, cannot talk, cannot sit.
Yes.
And the whole family is paying attention to him, and they are not working. And the guy, 37 years, is he not worth of than an old man of 80 plus years? So I think it's high time that the government urgently considers expanding social protection to cover vulnerable persons with disabilities like the deaf-blind. And the other urgent thing we need now, we need the government to support the production of transparent masks. Sorry, I did not come with one, but a transparent mask is, we have our colleagues who speak through lip reading. So when you look at them,
so if you're talking while your mask is on your lips, they won't know what you're saying.
Exactly. So we produce them to our members, but we're only able to access 200 members. That was our capacity. So if all, and these transparent masks are not only used by people who are deaf or deaf-blind, but even the media, even the health workers, because they're interacting with these people on a day-to-day basis. So the government should make it a priority to produce transparent masks, but also that should be accompanied by sanitizers provided free of charge to families, because this communication through touch, it requires constant sanitizing. I just sanitized my border when I was coming. I was caught up in the jam. I got out of the car. I got my sanitizer. First sanitized the where I was sitting. I came here. So the government must make that. Then the last thing is, my third recommendation would be that the Ministry of ICT should develop integrated integrated access to communication and information policy. Because, for example, if the audio-video messages were accessible to each and everybody, the gentleman or lawyer in Agago shouldn't have been shot by security operatives. We have most of our colleagues who were arrested during the curfew time working, but they were unable to communicate with the security personnel.
And some PWDs, even with the information in their midst, they won't be able to decipher the information that they are hearing or seeing.
Yes.
So then we need social workers in our houses. We need social workers on the streets, social workers moving with the police officers. Deborah, what do you think? Do you think having social workers on the streets, going into houses, trying to peruse through the different households, trying to find out how PWDs are doing, do you think that is a good way to handle this situation during COVID-19? And in your opinion, as NUDIPU, what are you doing as development partners to ensure that we alleviate some of the problems we've been seeing plaguing PWDs during COVID-19?
Thank you so much. The social workers is quite good. However, one challenge with them is that amongst the social workers, the majority, I wonder whether they know the aspect of disability. As NUDIPU, we have been sensitizing this awareness, but before, I gave you an example, Romeo. We've been in 30 health centers in Kampala here, and we have been passing out on this information about disability and COVID-19. And the health workers and the community are disseminating programs, having reach out programs in the villages. I would like to draw your attention to GBV. GBV has also been an aspect which we have been tackling. At the institutional level, for example, Chambugo University, the programs there, which are disability inclusive, students are learning some subjects, some course unit, and then when they go back to the community, they can able to understand these concepts of disability, and then and this is being used to be applied in their work. So I think different universities across the country can have these courses tailored for persons with disabilities. I mean, how to work with persons with disabilities. And then that is some good training that they must also have. And the other aspect, Romeo, is of the police officers who need to be taken into some training of persons with disabilities, how to handle a person with a disability. It's something that needs to be urgently attended to. Romeo.
And we need to also let the police officers know that being with a disability doesn't mean you're missing an arm or a leg. It could be something going on in your head. you know, a psychological problem. So there you have it. Last but not least, Robert Nkwangu, recommendations as we wrap up. We have a little bit like 2 to 3 minutes.
Yes, thank you. I want to touch on the issue of employment. It's a very big challenge right now. Because of COVID, most persons have lost their jobs. So businesses have collapsed, and then their capital is all gone. People have been eating their capital in their homes. So it's quite important that these are 3 things to be, I feel that one is NSSF. I can't forget NSSF. Because many have requested to have at least 20% of their savings. And then this, remember, Romeo, we talked of the persons with disabilities being so much at risk. So they need this 20%, please, to help boost their businesses once again. The other aspect, Romeo, is the stimulus, which is missed by persons with disabilities. The government is trying to give out some things, but greatest percentage they're missing out. So we need something tailored for persons with disability because they missed out. And then the other is adaptations at work. So it's waking up one morning at 8, you're going to office, and then you leave at 5, going back home. But the situation, people with disabilities can work from home. We can work from home. We can work effectively from home. We can ably do work. The big issue is that we just need consultation, because they sort of never consult us. Like we say, nothing for us without us. We need to be consulted. We have leaders. We need to be consulted in formulating these policies. We appreciate that the developing partners, for example, CBM and other partners, for working together with us. And we call upon more partners to come on board, support us to see that we put issues of persons with disabilities in response to COVID.
Robert Nkwangu, the representative of the deaf on the NUDIPU board. And also in studio we did have Mr. Jonas Waswa. He is the director of the Association of the Deaf Blind in Uganda. And also we did have Deborah Ayute. She's the programs officer at the National Union for Disabled Persons in Uganda. And we've been exploring the correlation between COVID-19 and people with disabilities, the impact of COVID-19 on these people, and whether or not the COVID-19 response strategy that we had in Uganda was responsive to the needs of the people with disabilities. My name is Romeo Busiku. I leave you with a simple note. It is important not to conflate health status with disability. So many people with disabilities are living healthy lives. Go out there and make it happen. Have yourselves a blessed day.